are substantially different from plain food from hypermarket, plain or meat, plain eggs and fermented dairies just from hypermarket? Is there a big difference?
I would like to hope that there is not, but I do think that there may be. And I'll explain that. I mean, the food that I eat mostly comes from a supermarket. Okay. And meat is expensive these days. Most of what I eat is grain-fed. I do buy pasture-raised eggs most of the time, but I just go to regular supermarkets here in the United States. I have a good friend of mine. He's very active on Twitter and on Instagram, Dr. Sean O'Mara. Now he would only just eat grass-fed, wild-caught, organic food, and and mostly just more like a carnivore diet with some fermented vegetables and maybe fermented blueberries. For the microbiome aspect of it. And he's looked at thousands of MRIs of scanning for visceral fat, and a lot of his recommendations are based on just simply his empirical data of what actually can help decrease the visceral fat the most. So I think he has noted that, basically, if it's wild caught, if it's a wild animal that was hunted, or at least grass-fed, organic, and fermented veggies and fruits are the best really for decreasing the amount of visceral fat. I think for most people, if they're trying to cut down on inflammation, may not necessarily have to go all the way to that level. It can be very expensive too, though. So, but I think for most people who are trying to improve their health, they could even do it just by eating food that they can buy at the supermarket. So, may not be for everybody. Some people may have to cut down on lectins, and you might even get some lectins out of grain-fed, because the cows are eating the grains that have the lectins. So you're not just eating. It's not just about what you eat, but it's also about what you ate. So you have to consider the source of food that animal had. Particularly, for like maybe hard to treat inflammatory conditions. But I think for most people that may not be necessary. And I'm part of that camp of like, well, I'm doing pretty well with eating out of the supermarket, and I try to eat clean. I haven't seen the need yet for me to try to only eat grass-fed, because frankly, I'll be honest, it's expensive, and even for most people, they may not be able to afford it.
Right, totally agree. A lot of Romanians twist their ankle or torn their ligaments right after they put weight, and they usually have these injuries while playing, for example, football, soccer, on a synthetic artificial field. Can we see a pattern here?
I think when the synthetic fields that came to the United States initially back in decades ago, when they were using AstroTurf, there were a lot of injuries that people were seeing, and the size of the spikes on the cleats also played a role too. I think back then they were using bigger spikes that really planted the foot on the surface, and so it didn't give way at all, and so they were coming down with like more ACL injuries, anterior cruciate ligament injuries. I think that now I'm not really practicing much of sports medicine anymore, but there are certainly synthetic surfaces that are better than others. But even I read an article recently about a new synthetic surface, or recently used synthetic surface, that may be still causing problems. I think the main issue too will be metabolic disease and the quality of the tendons. And then with putting weight, patients may also have more issues in terms of breaking a fall. I've twisted my ankle back when I was more routinely twisting my ankles running on trails. Many times where I was able to avoid injury, but simply by breaking the fall or by having a fast reaction in order to prevent the twist. But the patients that I see coming with ankle fractures, I feel like after talking with them, that it seems that once that ankle twists and they initially come down, there is no stopping their fall. And they're just gonna go down and hit the ground. And having good reflexes is part of what helps to prevent that. Having good muscle tone and not be sarcopenic helps with that too, that you're able to break the falls. I mean, I think if I were not able to break a fall or to have a fast reflex to break a fall, I would have torn many ligaments in my own body, years ago. So I think all these things come into play. The type of artificial surface, the level of fitness, reaction time, are the nerves working well where they can have a good fast reflex, or they're slowing down. And also very common too is to see patients with neuropathy, and I've had patients that they say, well, I've had neuropathy for years, and like, are you diabetic? I'm like, no, I'm not diabetic, so it's not diabetic neuropathy. But the truth of neuropathy or diabetic neuropathy is that it can occur earlier than the onset of diabetes. And patients can have diabetic neuropathy even before they have the diagnosis of diabetes. So I think that in that case, the neuropathy should probably be called insulin resistant neuropathy, because sometimes that precedes the diagnosis of diabetes. And I've seen that in clinical practice. And it's not because they have some other nerve injury. It's actually that. It's diabetic neuropathy. It's just that it preceded the diabetes. And so that as well can, lead to more difficulty with proprioception, particularly if they're doing any activities that require pivoting, changing direction, changing speed.
Yeah.
It can lead to problems with reflex times in order to break a fall if they twist the ankle, to prevent a complete fall rather than actually getting a fracture or a more severe injury. And so I do think that all these things come into play.
What is neuropathy in very simple language?
Well, neuro refers to, it's basically nerves, and pathy means disease. So it's disease of the nerve. So basically the nerve is not working as well. What you may usually see will be decreased conduction speeds through the nerves. Maybe the muscles are not as well as innervated. Maybe sensory inputs, from touch, proprioception, light touch, heat, things like that. It won't, that information won't conduct to the brain as fast because of disease of the nerve. And it's very common to see it on patients with diabetes or who have insulin resistance. That's probably one of the most common causes. I mean, there are many other neuropathy is just more like a generic term. You could have various causes to it, but I think one of the most common ones is going to be related to insulin resistance.
Good. We start to see here in Romania a lot of overweight kids that lack good nutrition and physical exercise. How is this affecting their growth?
Well, I think in terms of affecting their growth, it may be related to protein lack of protein. And I think in cultures where they've had lower amounts of protein, it does affect their growth in terms of their height. But, the obesity in children, it's a real problem here in the United States too. And I have seen already several children in my practice where they have darkening of the knuckles or the skin folds. And you talk to them and they say, oh no, that, they think that that's dirt that doesn't wash away. And it really isn't. It's something called acanthosis nigricans, which is a darkening of the skin, particularly on skin folds on the joints, or maybe on the back of the neck on the skin folds. And these are usually indicative of underlying insulin resistance. So I have to tell patients and tell their parents, these are signs that your child may be on the way to developing type 2 diabetes later in the future. So it is a problem, unfortunately. But in terms of growth, I have found it to be probably, at least from reading the literature, mainly related to protein, calcium, and vitamin D. And sometimes in some of the cultures where the diet is not very high in protein, that usually tends to slow down their growth.
A lot of moms give their children a lot of milk from the supermarket to help with the growth, to help with the calcium. Is this correct, or how do you see it, doctor?
I find this to be maybe a little bit on the controversial side, depending on like which guru you might talk with. I have not come across any bad studies regarding the use of milk for children for growth, and so I'm actually for it, not against it. Like now, the milk that if I really have my choice, and if money were not an issue, it will be milk that is from A2 cows. We have the A2 casein protein, not the A1 casein protein. I do think that the A1 casein proteins in milk, which is really most of the milk we have here in the United States, tends to cause more inflammation and gut issues. And I think sometimes people may think that they are lactose intolerant, when in fact they just have more of reaction to milk that has the A1 casein protein.
That comes from the Holstein cows, right?
Yeah, the Holstein cows will, unfortunately, the cows that make more milk are the cows that have the A1 protein. And usually, the Jersey cows or some other ones that tend to have more of the just the A2 milk, the A2 protein, and not the A1. There tend to be cows that don't make as much milk. So that's, unfortunately, that's the issue. And so, but if I had it my way, that's what I would do. But I do drink milk once in a while. I don't think it's something that adults need to be indulging on. And certainly, it's actually a way to put on weight in adulthood. But the casein proteins can metabolize to molecules similar to endorphins, and so there's a little bit of an addictive component to it. And so it tends to be something that it's meant for consumption to help with growth, and it makes sense. That babies will nurse milk in order to help with their growth. Once you're an adult, you're not really growing anymore. So I'm not against milk in adults, but it probably should just be used in small amounts for moderation. But I think for children, it can certainly be helpful, though. And I've looked at studies that, and I think maybe studies out of India, that it certainly can help with bone growth for the children.
And would you recommend it, or what's your opinion regarding raw milk or pasteurized milk, or it doesn't matter?
Yeah, that's kind of tricky. And I almost mentioned that, but I decided not to. I think the pasteurization process, as well as maybe A1 milk, A1 casein protein milk, can lead to some inflammation and gut issues. The problem is that, pasteurization came about for a reason, though. Back in the days when, we had sweatshops, over a century ago, and then the milk was getting contaminated, and then, people were dying from contamination. Well, I think if the milk is well sourced, then I think raw milk can be beneficial. But this is one of those issues where you don't want the pendulum to swing too far to the other side, where you say, well, pasteurized milk is a problem, it's causing gut issues on people, you're better off drinking raw milk. And if everybody starts drinking raw milk, what might happen is that somebody's going to get sick and maybe even die too. So the milk has to be well sourced. You have to trust the source of the milk. Make sure that it's handled in a very sanitized way. And I've had raw milk myself, and I can tell you that it was actually quite amazing. This A2 milk that a patient of mine brought me, and her husband brought me, they had just got in the milk that morning. The milk they cow that morning, they immediately put it in a chill on a freezer to chill it, and then they bottle it. They brought it to the very clinic that day, and it was amazing. It didn't really have any gut-related type of issues or discomfort that happened when I drink large amounts of regular supermarket milk. But it has to be well sourced, and so that's why I think usually the state authorities here are kind of a little worried about that. But I'm not against it. You just have to know your source.
I interviewed some villagers that are 90 years old, 95, 98 years old actually, and when they shook my hand, I felt so much power in them, and I would see them totally be flexible and dynamic, while I see other generations like having 70 years old, and they're pretty much stiff. Can we learn something from our elders regarding nutrition, regarding lifestyle, regarding development?
Absolutely. And it's kind of the philosophy that I've kind of developed, and not unique to me. I'm sure many people feel the same way, is that a lot of the recommendations for diet and activities may come from studies. The problem is the methodology for the studies. How well are those studies formulated? And even more importantly, who's funding them? Because a lot of these studies are going to get funded by people or by entities who will have some sort of financial gain. And what we have neglected is just using common sense, logic, and reason. And so what we have to do is become what I call food philosophers. Okay. Does it make sense to take the fat away from the milk and turn it into skim milk? Babies are not drinking skim milk out of the breast of their moms. They're drinking whole milk, right? Raw, unpasteurized, Does it make sense to blame, ancestral foods like meat, these conditions that have developed only in the last 150 years? Okay. So I feel like a lot of the recommendations just don't make sense, and a lot of the studies can have confounding variables. Usually the studies blaming red meat are actually have confounding variables. The people who were eating meat were also smoking and drinking more, and generally just living a worse lifestyle. And then they want to blame the meat for that when their health problems were caused by all these other issues. And so I think it's important to develop what I would call a food philosophy. Does it make sense to be removing the fat of the milk? Does it make sense to be removing the meat from our diet? Does it make sense to be blaming ancestral foods for our modern problems? If a food is bad for your teeth, is it possible that it could also be bad for the rest of your body? And so, a lot of the foods that we eat today, cereals and breads and things like that, they get metabolized in the mouth by bacteria, which then lead to cavities, but, a diet that is just consistent of like meat, eggs, or low carbohydrate foods, usually will not lead to dental problems. And so, absolutely. And we have to, our mindset needs to be to follow an ancestral diet. What were our ancestors back 200 years ago? Now, maybe they were not living long lives because they didn't have antibiotics, they didn't have sanitary conditions, or they didn't have hospitals that were able to treat, an acute infection. But they didn't have all these chronic diseases that we have now. Heart disease, type 2 diabetes, obesity. They were almost essentially non-existent. So, we should be eating foods that they were consuming. And then you only then make changes if there's compelling evidence to make changes. Now, the fruits that we have today are not the same fruits that they had 200 years ago. Yeah. Okay, so you can't just say, well, they were eating fruits, so I'm going to continue eating fruits. Well, you might have to make change on how you eat a fruit. The current fruits that we have in the supermarkets are hybrids that the fruit companies develop in order to get more sugar in them, to get more fructose on them. The fructose is going to be very sweet. I even remember when I was a child, the grapes were like dark and they were like this small. this is when I was growing up as a child in Puerto Rico and then in Miami. Now the grapes are huge and they all look the same.
They don't have seeds.
They don't have seeds. So the fruits are not even looking the same compared to when I was a child. And these ones are just more like little sugar bombs. And so we have to consider into the fact that they're not really the same fruits. So maybe we should change a little bit of how much we eat them. Maybe we eat them less, or only go for the fruits that have a low glycemic load, or just try to eat them like our ancestors did, which was like seasonal. But our base, our foundation should be an ancestral diet. If there's any question, if there's lack of information on what's beneficial or not, the foundation should be, our home base should be eating an ancestral diet. And then you can make changes to that to adjust for particular individual variations or particular health conditions. Maybe somebody reacts to a particular food item and the other person doesn't, or this food item is not the same way it was as it was 200 years ago because of genetic hybridization or even GMO or what have you. But the foundation should be an ancestral diet.